Hello, everyone, and thank you so much for joining today. My name is Juliana Raja. I'm CFHI Practicum Coordinator, and I'm so pleased to welcome you to the Practicum Showcase today, where we're going to be highlighting reflections from past CFHI participants and hearing from the perspective of preceptors. Whether you're currently enrolled, whether you're considering a future program, or whether you're simply curious to learn about the CFHI Global Health Practicums, we are so glad you're here. CFHI is a nonprofit organization that offers ethical, fair trade, global health opportunities to students and to academic partners. And amongst those programs are our practicums. And CFHI programs are deeply rooted in an asset-based approach to global health education. This means that our local partners, that is, health professionals, community leaders, and organizations are going to lead the way in defining priorities and shaping student learning experiences. This approach ensures that the practicums and all of our programs are grounded in local realities and respectful of context and focused on long-term impact and sustainability. Today, you're going to be hearing from the perspective of our students who have been able to participate in place-based, hybrid, or virtual practicums. And they're going to be sharing a little bit more about what they worked on and what has stayed with them. And the goal of this showcase is not just to be able to share those experiences, but to start conversations about what meaningful global health engagement looks like and how students and communities and preceptors can continue to learn with and from each other. So we're going to get started with first, what is a CFHI practicum? And a CFHI practicum is a structured, supervised, and professional experience which is created and grounded again with the local leadership and community strengths. So rather than focusing on deficits or needs, we prioritize on existing expertise and infrastructure, and students are contributing to these ongoing efforts through their programs and practicums. In addition, CFHI is aligned to that all CFHI practicums are aligned to at least 3 competencies that are outlined by this Consortium of Universities of Global Health, or CUGH, and this provides a solid foundation in global health education. In addition, of course, we take into account academic requirements such as permitted deliverables, learning objectives, required hours to ensure that the practicum supports both institutional standards and, of course, meaningful engagement from behalf of the students. And while, of course, we take student interests and academic goals into account during the practicum placement and project design, we also encourage students to remain open to exploring new areas and responding to those local priorities. Often the most meaningful experiences can come from engaging with unfamiliar topics and embracing different realities in diverse settings. And now we're going to have the opportunity to hear about that experience from Gianna, who had the opportunity to participate in a program with the India team. So can you tell us a little bit about your experience, Gianna? Thank you so much again for being here today.
Can you guys hear me?
Yes, we can hear you.
Okay, awesome. Sorry about that. I'm on my phone, so it's just a
No
little difficult to
worries.
navigate this. But yeah, my experience in India was absolutely life-changing for me, as I knew that it would be. I also knew that it would be very challenging compared to several other places that I have traveled. I was rooted in Delhi, which is the second largest city in the world, and very different from a lot of the more rural places that I've lived previously. I think above all else, I learned a lot about myself and what I was capable of, not just in a professional setting, but sort of in a personal aspect as well through this program.
Okay.
I remember so many times through this program showing up to all these different places and just thinking to myself, like, who decided that I was even qualified to be here in so many ways, just because everything felt so new and different. And just I was kind of encouraged to explore a lot of areas outside of my main background. I attend the Natural Medicine University in Portland. So my background is mainly in herbalism and natural medicine, and um, I was really encouraged to branch outside of just kind of that main background that I had and start to explore some other areas of what was needed with the organization that I was working with. So I feel like there was a lot of growth that happened
Yeah.
through that, and I'm really grateful for all of that.
Can you tell us a little bit more of working like with the organization you worked with, the Society for Promotion of Youth and Masses, sorry, which is a nonprofit in India. Can you tell us a little bit more about, what your focus was? You're mentioning that you were encouraged to branch out, but what was that process like with your preceptor and also like working on those deliverables for your academic requirements as well?
Yeah, absolutely. So my project was basically centered around helping to write programs for SPYM that focused on integrating mindfulness based interventions into rehabilitation programs across their several different facilities. I was given the task of mainly working in the children's facilities, which was really interesting for me because I have never really worked that closely with children before. And also, I quickly realized that many of them don't speak the same language as me. So, yeah, it
Got
was
it.
just really interesting to navigate that. Luckily, I had so many great interns that um, helped me in the process of learning to translate things and just learning to show up and sort of hold space and hold communication in other nonverbal ways that were really impactful as well throughout that process. I felt like, oh gosh, I feel like there's so much I could say, and sometimes it's so hard um, to
Yeah,
make it
yeah.
shorter than I need to.
It's
But
okay. Maybe you can tell us a little bit, like through navigating these different like barriers, cultural language barriers. You mentioned you grew so much, and you had a lot of support from like local interns and like the local community. Can you tell us like how that impacted your work and like do you feel that working so closely with the like community had a final impact in your deliverables, as to say, like if they hadn't been there, how would your
oh,
final
absolutely,
deliverables
absolutely.
have been
If
different?
I had not had the support systems that I had, I just think there's really no way that I could have learned so much about what the needs were in the particular settings that I was working in. I think there's, oh, how do I say this? People speak English mostly in an academic or a medical setting, so there were certain people in the different facilities that I could communicate with. However, most of the children and the patients themselves don't speak any English, so I think without the interns just helping me to translate and connect directly with the children, I would have missed such an important piece of assessing what was actually needed in those spaces, what kind of programs were well received, what kind of programs that we worked on implementing that maybe weren't so well received,
Mhm.
and just sort of learning about the backgrounds and the lives of those children and how that might impact what they might be looking for or what might be beneficial to them, kind of
Yeah.
on an individual and a group level. So I think, yeah, having that direct support and people who could help me directly interact with the children and with the patients was so essential to figuring out what is really needed rather than um, only having talked with the workers or the medical professionals who might have their own ideas of what is needed based on their observations, but we still need to understand both pieces, if that makes sense. So I think
Yeah,
it
of
was
course.
just so essential to have that
Yeah.
more direct support as well.
Yeah, of course, of course. And we can definitely see how something very important that you developed and showed during this experience was cultural humility, right? Like not sort of
Oh,
imposing
absolutely.
or assuming, but rather, having this curiosity, not this certainty of like this is the program they need, but understanding that context and understanding, those realities and being able to address them. And it's actually really exciting to know that you're going to be going back in a few weeks and you're going to be able to continue to contribute. So we look forward to learning more about that and seeing that. And I maybe just wanted to ask, what did you learn in terms of health systems and healthcare delivery in a different context? You mentioned that you are academically like in the United States. So this is a very different health system and a different modality of healthcare delivery. Can you share a little bit, about how, like, maybe your perspective shifted? And yeah.
Yeah, there's a lot to say about this also. But I'll try to make it quick. Um, I've never been to a rehabilitation center in the US, so I can't exactly speak on that directly, but I found that the thing that I was most surprised about across the board is how welcome I was as a foreigner and an outsider in all of these different spaces that I was entering. And I think from my perspective, I was very nervous and apprehensive at first a lot of the time because I was kind of like, I don't want people to feel uncomfortable that I'm an outsider coming into a space where they basically live their daily lives, like basically a space that is their home. And I just feel like that would have been received very differently here in the United States, but it felt like all of the different centers that I visited, everybody was like very excited and had lots of questions and wanted to know like about me and about what things are like in the US. So I just found across the board that people were very excited to collaborate and to also learn about us and about how we are doing things in the US. Whereas I feel like, I don't know, it could have been very different here.
And
And I
that's
also heard that from several of my housemates who were doing different sorts of clinical rotations in other health settings that most of the people they encountered were very excited and just very willing to share and learn with one another. So,
Yeah, that's one of the amazing things of these programs, the exchange and like how learning goes both ways. People are learning about your culture, about your systems, and at the end, all of those things go on to spark ideas later on that can really change things. So, it's really interesting, and I appreciate you sharing that perspective. Just to finish off, can you tell us a little bit about how has this experience influenced your like your career or like your professional um, yeah, path, if in a way, and what would you oh yeah, let's start with that one.
okay. I've actually done quite a bit of professional writing work in the past for various organizations. Most of it has been more scientific based, and I think this really reawakened that desire in me to kind of start to pursue writing again. I feel like it was so important to me, especially toward the end of my project, to sort of figure out how to give these children a voice through the programs that I was writing. And I think there's so many ways that we can help do that for people who may not always have so much of a say in several aspects of their life. I think that our writing can be a super powerful tool to help give those people a voice and help give them sort of a sense of agency as they navigate through their healing process. So I definitely left feeling encouraged to pursue writing again. I also was really fortunate to find out about a homeopathy study that SPYM is pursuing toward the end of my time in India. And I feel like that also sparked my desire to maybe look into what it would be like to do more natural medicine research in a similar setting in the future as well. So I felt really excited to learn about that and learn how that might be applied on a broader scale.
Okay. And then to finish off, what advice would you give to a future student considering a CFHI practicum?
Okay. My best advice would be to um, actually get on a call and connect with somebody who has been in the location where you're going if you're able to. I had a lot going on before I started my practicum and I was actually traveling elsewhere, so I didn't have time to do that. So I went into Delhi knowing essentially nothing about what I was going into, which is okay, and I navigated through it eventually. But I would suggest really just trying to get comfortable with the area that you're going into. I felt like I spent so much time and energy just trying to learn how to navigate my environment. And something I'm really looking forward to about going back this next time is hopefully being able to put more energy into the actual work I'm doing now that I know how to navigate my external surroundings. So that would be my best advice, is just to try to connect with at least one, if not more, people who have actually been and worked in the particular country and setting that you're going into, and just try to go into that with some knowledge and understanding if possible.
Yeah, thanks for that. It's worth noting that CFHI launched an alumni program, so you can connect to an alumni from one of the programs. So that is a resource that is available. CFHI also has like our Pretty Departure training, and it's specific to each site. But of course, a conversation with someone that's been there has no replacement. So thank you so much for sharing your experience. Again, we look forward to hearing back about your experience in May and also about your future endeavors. So thank you so much again for being here. And if anyone has any specific questions for Gianna, maybe she can stay on and we can write them to her.
Yeah,
Um,
absolutely.
thank you so much again for being here. And now we're going to switch on over to Kara. So, Kara, thank you so much for being here today. You're going to be explaining to us a little bit about your experience in a virtual global health practicum with the Ghana team. And you worked around HIV. I remember in our initial call, you mentioned, you were interested in maternal and child health, but were really open to exploring other topics. And Dr. Charles came up with a personalized outline that was around HIV. So can you tell us a little bit, when you came into the CFHI practicum, what or what can you tell us a little bit about that role of the process in a virtual practicum?
Yeah, thanks for having me. I didn't really know what to expect going in, but after meeting with you and Dr. Charles and getting my practicum outline, definitely had a better understanding. So I did more systematic reviews on the literature available for the different HIV PrEP medications. Um, and I have a pretty extensive background in research, but I've never done systematic reviews. So it was new in that regard. And then, as you stated as well, I enjoyed or find a lot of purpose in working in women's health, but I haven't done a whole lot with HIV/AIDS, and I especially didn't know a whole lot about HIV PrEP. So it was exciting that it was a new topic, and it was a new skill set that I got to develop as well. Oh, you're muted, I think.
Thank you. Sorry about that.
Okay.
So this is a really good example again of how, of course, your interests and like your affiliation towards certain topics are considered, but again, understanding those local like realities and local needs and what is more pressing, a different practicum topic came up and you were really able to engage. Dr. Charles, who will be shortly, really talked about the like the quality of your program and like of your deliverables. Can you tell us a little bit more, what exactly, like you were mentioning the systematic review, what skills did you develop? You mentioned you have a background in research, but what specific skills do you feel you developed? And it's also a virtual practicum, right? This is also challenging in like time management skills. Can you tell us a little bit about that? Like what skills did you develop during your virtual practicum?
Yeah, so I think first the virtual practicum requires a lot of autonomy because we're not in the setting with our preceptor. I met with Dr. Charles on a biweekly basis. So, and to get my 120 hours in the month of February, that really did require a lot more independent work. So that was eye-opening in and of itself, and just learning what I needed to get done um, to prep for my meetings with Dr. Charles. And then the other skill that I developed was learning how to develop a thematic framework to advocate for the usefulness of a new medication in a global context. So lenacapavir is a new PrEP medication. It is FDA approved for HIV resistant treatment. Um, so it hasn't been FDA approved yet, even in the United States, but just understanding and learning about, just because a medication is useful or effective and safe, you still have to learn how that can be implemented into a different health system. So, I live in the central south United States, so it's completely different than healthcare in Ghana. So just working with Dr. Charles, and he helped me develop a framework, which then guided my review of the literature, um, and just understanding how lenacapavir specifically can fit into the context of Ghana was a pretty eye-opening experience.
Yeah.
Yeah.
Can you tell me, like during this navigation, and you just mentioned like the difference of healthcare systems, we touched upon it before, but like cultural humility again is something that's really important, like during this process. Can you tell us maybe a little bit more about, what did you learn more about healthcare delivery? You said like learning about the context and the framework. But in general terms, can you share a little bit more about that? And how did this practicum expand your understanding of like the implementation of global health programs?
Yeah, I think I'll start with the most challenging part of my project was the limited available literature, especially in Ghana specifically. Most HIV studies are done in African countries that have a much higher prevalence of HIV AIDS. And so in the western part of Africa, their prevalence is low, so they don't get as much attention, I guess. And so it was interesting to learn about the differences between, even in Africa, within the different regions, how global focus is distributed throughout that continent. And so for example, one of the pieces of the thematic framework was looking at the operational feasibility of lenacapavir,
Okay.
and that requires implementation studies. So um, there's no implementation studies. So there's for in any African nation with these injectable PrEP medications. And so it was hard. I really struggled with trying to find an evidence-based recommendation for lenacapavir.
Hmm.
Um, and it was eye-opening. Most of the studies that I did find talked about the importance of implementation research needed in Africa for these for medications, because they'll do the studies on the drugs, but then there's no follow-up after the fact on how they can successfully implement it into their infrastructures. Thankfully, Dr. Charles helped me find some art delivery models in Ghana.
Okay.
Um, so then I
So
was,
art is antiretroviral therapy, just
yes,
thinking.
yeah, thank you. So I was able to like provide a hypothetical on how lenacapavir specifically could be implemented. But that was, I think, most challenging part, and the most eye-opening part is
Yeah,
more
like there's so much in theory, but when you go to apply it to all of these different contexts, all of these different realities, it's not a one size fits all. And being
right.
able to even acknowledge that, and being able to acknowledge the gaps is a very important step in global health. Like we acknowledge these gaps in that we don't have these studies, these implementation studies. So this is like a step, and this is something that's really important, but definitely challenging. And it's great to know that Dr. Charles was able to help you navigate this, and sort of take a step back and acknowledge this, and be able to produce a hypothetical deliverable with this. Can you tell me a little bit, this experience, can you tell me if or how has it influenced your career goals? We were just talking about how you're about to graduate. Did this practicum in February in any way change sort of your interests? Again, this is all hypothetical, life changes, but sort of was anything sparked during your time with the CFHI practicum?
I think it just validated and strengthened my desires to work in global health contexts. And
Mhm.
it also encouraged me that I can do, I can still help from a virtual, or, just given my life circumstances right now, it would be
Mhm.
difficult for me to actually travel and live overseas in the global health context. So it just helped me, um, it validated that I can still be passionate and work in a global health context from where I am in my life right now, and from the comfort of my home, for lack of a better word. So I, yeah, I have a heart for global health, so I'm hopeful
It's
that this will, launch me into that career path.
Yeah, no, and it's really important what you're saying, like just due to different realities and everything. But you mentioned throughout your um the time that you've been speaking, like connecting and being able to work with Dr. Charles, and like virtual settings allow us to do that. So I'm glad you were able to explore that and being able to connect again with local leadership and understanding. And we're now going to have the opportunity to actually hear from Dr. Charles, just the other side of the story of, how was your practicum created? So, Kara, thank you so much. Also, if you have any questions for Kara, please feel free to write them in the chat. But Kara, before we move on to Dr. Charles, what advice would you give to a student considering a CFHI virtual practicum? You mentioned a little bit about like time management, but in general, what advice would you give? And then we'll hop over to Dr. Charles.
Yeah, I think I mentioned it earlier, the virtual practicums really do require more autonomy. Your preceptor is definitely there for support, but I think it's really important to make sure that you understand your practicum outline and what you're required to do. So like in my case, it was an extensive literature review. Um, and so you're coming into this not, if you don't have a lot of experience in that, like really learn what all that entails, because it's going to require, um, you don't want to be learning how to do it and wasting time learning how to do something, that can take away from actually the work itself. And so um, I think just knowing going into it, it's a lot more independent work than um, what you may be expecting. So, Dr. Charles was definitely there if I needed him, but we had a 6-hour time difference, and you know, just things like that. It's just important to know that it will require autonomy, and sometimes you may have questions during the week that you may not be able to get answered right away. And so just trying to navigate
Yeah.
learning how to do that yourself, I think is,
Yeah, that's definitely like an important skill, like in a global health context and realities, and being able to develop that. But thank you for sharing your experience, and it's great to know that your commitment to global health was really like reinstated or like fueled.
yes.
Yeah.
Thank you so much.
So now we're gonna hop on over to Dr. Charles. Dr. Charles, thank you so much for being here today. Dr. Charles is the medical and program director for our Ghana programs. He's also the preceptor for both virtual and place-based practicums for the Ghana site. And Dr. Charles, we just heard from Kara, who was a virtual practicum. Can you sort of walk us through what the steps are? How do you create this practicum outline? We were discussing and we saw a lot about the asset-based approach, but sort of when a student shows interest, can you tell us a little bit, what those steps are in creating that project outline?
Okay, hi. Hello, everyone. Creating an outline, um, one of the most important thing is, I think the most primary thing in for a student doing a practicum is that to ensure that the students are actually gaining and reaching the competencies and expectations. You understand that it's a requirement for their program, and they can achieve it in so many ways. You know, whether virtually on ground. So the first step, I mean, when the time I look at a student's CV and the letter, I try to see is there any interest and experiences that aligns with areas that I work with. So basically, I mean, my areas, of course, Juliana also has experience and knows by the time she reads your work, she may say, okay, this person is interested in maternal health. Dr. Charles works or child health or sexual health so she already knows people that work in practical areas, disability, so these are, I'm just giving examples of health systems, policy. I mean, a lot of us work in similar places, but there are most of us that actually, for example, now when it talks about this that has to do with rehabilitation or disability, it's a field that I am on top of the game currently now. Sexual and reproductive health are rights, infectious diseases, especially HIV, anything that has to do with gender equality, anything that has to do with health systems strengthening, there are areas that I have worked with. Anything that has to do with, so I mean, there are some areas that is quite broad, but you find out that I can try to meet the students as much as possible, in some of these areas. So what I do is I look at your CV, and sometimes you might even have something you're working or something you have worked or something, the way you write your letter, you show interest in something. And I ask myself, what is it that is happening in Ghana, that I am aware of, or, or something that I have worked or something that I even have interest in, I have knowledge or interest in. So there are so many ways to look at it. It can be something on ground, it's something Ghana needs and something that can be advocated for, like HIV interventions, not just as Kyra just presented. I mean, that drug is not yet used in Ghana, but it's something that is being talked about because it's a new intervention. You understand? It might be something that we have done, actually, a project we have done, and we need someone to review and improve. It can be something that we have not done. It can be a topic of interest that is valuable to Ghana. You understand? It can be something that we've done for the past years, but they need to revise motor revolution. So it can be in so many directions. You understand? And so from there we now identify your interests and align these interests, as I said, just as you said, that's the second part I will just try to explain. Then I'll create an outline and share. Sometimes we have students that are very, very new in the field of public health. They've just started and they're just open. Those are actually the best sometimes, you understand. It's easy to now say, okay, how can I start with this student something basic that they can recognize as a new skill? You understand? Sometimes I see that you might have some talents that might actually benefit us, you understand, because you have experience doing something, and you may have to contextualize that experience to, sometimes I may want you to understand that, what you have done in your own area might be different, so different in Ghana. Let's also say you may be used to working with, children and parents with disabilities in the US. I want you to come and understand the context in Ghana and see the whole difference. So I just try to align. It can be opposite. It can be, but the fact that along this, you're going to benefit and gain some competencies and definitely knowledge, skills, and attitudes. So then we now create the outline share. You now, have a meeting, just as you said, schedule the meeting with the student to discuss and everything. Then we now finalize. And there are now some administrative procedures, from your institution, and then we decide the time we start. So it starts, but one thing I would say is that on the long run, you understand, a lot of us have been trained and skilled, in these aspects, not just from experience, but even formally trained in education, because right now I'm actually formally trained in medical education for healthcare professionals. I have a degree in that. So we try to meet students, needs and expectations based on your level. But one thing you need to know that this is what we call andragogy. Andragogy is adult education. Just as Kyra was saying, there's a lot of independent work that will have to be done on your own. So, and that is how postgraduate education, you have to learn how to build. We will only provide the scaffold, support, and give you links and feedback. And, but you have to learn a whole lot of how to go about it on your own. It's not difficult because your university usually provides some of these things, how to search on data bases, how to cite, you understand, how to improve your writing. Some of these things, you even, by the time you go on YouTube, you can learn how to even do some of these things on your own. But you have to take responsibility, you understand, and ownership, you understand, of your education. And you have your mentor and supervisor like myself guiding you through the whole process, giving you feedback. You are supposed to make mistakes. That is the idea. You understand? So, but when you make mistakes, you come, you understand, or you write something, we channel you to direction. So it's actually a fun process. It's an adult kind of educational training. It's not about getting a high score. It's about actually building skills and competencies throughout the process to see that you are improving. You understand? Then by the end of the day, you can see that you've benefited, you've learned, and you've created deliverables that are actually outstanding and can be useful in the community. So these are just some of the key things I just wanted to say about from my perspective. Thanks, Juliana.
Thank you so much for sharing that, Dr. Charles. I want to highlight that this meeting that's mentioned here is that meeting that Carol was referring to. The idea is that students receive the outline. All students receive their practicum outline before their practicum start date, and there will be contact with the preceptor to check for alignment and be able to discuss and make sure that everyone is aligned as to what is being done, the objectives and the deliverables. Also, something that I think is really valuable, as Dr. Charles was mentioning, sometimes there's skills in the CV that we might consider or might not consider relevant, but they are. I remember students that have graphic design that have actually contributed to the creation of material, or a student that had video editing skills and they created a video. So all of this is really considered and created, again, really aligned to those ongoing efforts, ongoing needs, ongoing realities. Thank you, Dr. Charles, for explaining a little bit about the example. This is the process that is done with our preceptors and our teams for practicums all around. And well, what about CFHI Practicums? Just to go closing off, we have virtual, hybrid, and place-based opportunities, and they go from 4 to 12 weeks. We have different sites, and I'm very happy to be able to discuss further if you are interested. These are our websites, and we're going to stay on for a few more moments to be able to discuss and ask if you have any questions. But I really want to thank everyone for being here, both our alumni, Kara and Giannia, as well as Dr. Charles, for being able to share their perspectives and being able to, just share about the practicum process and all of those skills that are developed, what's considered. So thank you everyone for being here today, and we're going to stay for a few more moments in case there's any questions.